Hello, my name is Yoshihiro Katsuura, and I'm a board-certified orthopedic surgeon practicing in Northern California. Today we're going to talk all about spinal decompressions. We're going to learn what is a spinal decompression, what are the different types, how are spinal decompressions performed, what are some common problems with spinal decompressions, and finally, who should have a spinal decompression. So let's jump right in. How do spines and nerves become compressed in the first place? Some common sources of spinal compression include bone spurs that have grown out from arthritis, thickened ligaments from your body trying to repair old injuries and chronic disc degeneration, collapsed or malaligned spine bones, vertebrae that become kinked and thus compress nerves and or the spinal canal, and then herniated discs. These are the most common sources of spinal compression. You can see my videos on back and neck pain for a detailed description of this phenomenon. When the spine becomes compressed, or when these things occur, it takes up space in the spine, it pinches nerves and causes a condition known as stenosis. That's just a fancy medical term for narrowing. So what does this look like? In this cartoon, you can see how a degenerative disc can actually rupture and herniate into the spinal canal and cause compression on a nerve root. You can also see how, as a disc collapses and undergoes degeneration, the spine can buckle, and this can result in compression of the spinal canal, causing pinching of the nerves as well. So what is a spinal decompression? A spinal decompression is a catch-all phrase that we use to describe any surgical procedure to take pressure off of the contents of the spinal canal, namely the nerves. This includes procedures such as a laminectomy, which you might have heard of, foraminotomies, and discectomies. Anything that we use as spine surgeons to surgically remove things that are pinching the spinal nerves. The term laminectomy is a medical term and basically is a combination of two phrases. One is the lamina, which is a piece of bone on the spine that covers the roof of the spinal canal, and the other is ectomy. Ectomy is a Greek word used to describe the removal of something. So we combine these two words, and laminectomy means removal of the lamina. Decompression surgeries, laminectomies, discectomies, foraminotomies, these types of procedures are extremely common in the United States, with over 600,000 procedures performed per year. In this video, we can see the various areas of the spine. First, we see that a spinal segmental unit is composed of two bones, and they're connected by a disc, and there are many of these units throughout the spine. And there are also various areas. You can see that there are two facet joints on the back of the spine that connect the spine as well, and there's ligament in between those two bones. And so a laminectomy, which we can see here, we just remove the back portion of the bone, and then that ligament in the center of the spine is removed. That's called a flavectomy. When we remove part of the bone on the side of the joint, that's called a facetectomy or a partial facetectomy. So what is a laminectomy? As I described earlier, the lamina is a part of the spine itself. It is the roof of bone that covers the spinal canal, which is a tube. You should check out my videos to get a better description of this, but we'll also show you on some of the cartoons in this video. So the lamina must be removed in order to gain access into the spinal canal in most cases. So this is a standard procedure for almost all spinal decompressions. It's like taking a manhole off of a sewer so they can get in and do some work in the sewer. That's the exact same analogy that I used to describe a laminectomy. The lamina can be removed without any ill effects in the spine, and so it is not a critical part of the spine, in other words. So in this little cartoon here, you can see how there has been disc degeneration, and then there's now stenosis pinching on the spinal nerves. And we go down and we perform a laminectomy first by carefully drilling off the bone on the dorsal surface of the spine and then removing that thickened ligament, the flavectomy, to actually relieve the pressure on the spinal canal. Some patients may worry about having this area of their spinal canal exposed, and some people ask, will I be prone to injury in that area? And the answer is no. First, you have a large amount of soft tissue that will form over that, but actually in surgery, we will put a little sponge over that area to protect it, and then ultimately bone will regrow over that area once it's been cleaned out. So what does this procedure actually look like when you're having it done? You're typically lying down on your stomach, an incision is made on your back, and then the spine is exposed, and then that area of the lamina is carefully drilled out, and then we use various instruments to remove the dense connective tissue that's covering the spinal canal, and then all the bone spurs that are growing into the spinal canal are they're carefully drilled out or removed, so you have nice clean flow of spinal fluid and the nerves are not pinched anymore. So another very common procedure that we do in conjunction with the laminectomy is typically a discectomy. A discectomy is removal of part or all of the intervertebral disc, so that's the spongy structure that exists between the two bones of the vertebrae. And this is typically done in conjunction with the laminectomy. Again, the laminectomy is used to get access into the spinal canal, and then we move the spinal canal contents to the side, and then we can get access to the disc. That's called a discectomy. When you have a disc herniation, usually a lump of tissue is exploded into the spinal canal, and that's a free-floating fragment. So once we get exposure of that, it can be plucked out relatively easily. It does not necessarily mean the entire disc is going to be extricated. So in this cartoon, we can just see an example of what a discectomy looks like. We can see that there is a disc pinching on a nerve, and we get access into that area, and then we're able to simply just pluck that disc material out of there, relieving pressure on the nerve. One of the confusing things about modern day spine surgery is that there are a lot of different techniques. And really, a lot of these different things have and can be used to perform the exact same surgery. And so with that has come the advent of so-called minimally invasive spine surgery. What minimally invasive spine surgery basically means is that we're going to use smaller incisions and less invasive techniques to gain access into the spinal canal to decompress it. Minimally invasive spine surgery is typically done either with an endoscope or with some sort of microscope and a small incision used to gain access. I think it's really important to remember that essentially all spinal decompressions are the same procedure. It's just a difference in how they're executed and how they're done, but the complication rates, the recovery times are all essentially identical. These are just things that some spine surgeons have come up with to hopefully limit soft tissue trauma. I do think that they are useful in certain situations, but not all. Again, it's just a tool that we use, but I really think it's important that patients understand that it's still spine surgery, it's still invasive, and you still have to really trust the surgeon that you're having it done by. And now I hear patients always asking about different minimally invasive techniques. I think people are really interested in it, and I totally understand why. We want the surgery done through the least invasive means possible. But I also think it's important to remember that we want the job done properly. We want to get a clean decompression. We want the nerve roots free at the end of the procedure, and we want to do it without any complication. Let's take a look at what a minimally invasive decompression looks like. First, a tubular type retractor is inserted in the area of the spine that is of interest, and then we carefully drill out the bone. Again, there's very limited soft tissue damage in this case because we're only exposing a small area of the spine, and then working through this tube, we're able to perform the same laminectomy and decompression and get the pressure off the nerve roots. So it can be a quite elegant procedure. One other term that I think is really important to explain is this concept of an indirect decompression. Now, to understand what an indirect decompression is, you have to understand a little bit about spinal pathology. Sometimes the spine becomes very poorly aligned. It can have kinks in it, and there can be slippages of the discs, such that even performing a decompression may not be enough to get things totally decompressed. And so in those instances, we reconstruct the spinal column itself, and actually putting the bones back into place is what decompresses the nerves and the spinal canal contents. In this video, you can see what that looks like. Here is a slipped disc, and the spinal canal is clearly compressed and kinked, and to get that back into place, we needed to do what's called a spinal fusion, but actually removing the old disc and inserting this false disc or cage to get things back into the normal shape and normal alignment. That takes the pressure off the nerves. So another question that I frequently get from patients is, can the spine be decompressed without surgery? Now, on the market, if you go onto Amazon, you're going to find tons of different devices that are purported to be able to decompress the spine. These are traction devices, inversion tables, and all kinds of wacky gizmos exist out there. In my experience as a spine surgeon, seeing multiple cases of stenosis, doing hundreds of these surgeries, it is impossible to get a decompression of the spine with severe stenosis without actually going in there or removing it. It's unfortunately just like a clogged pipe. no matter how much you tilt the pipe or twist it or do whatever, it's not going to get unclogged unless you actually get in there and remove the clog, and that's what spinal surgery does. But in some mild cases, it may not hurt to try some of these under physician supervision because they could offer temporary relief. Will they cure the problem? No, but maybe they'll help you with your symptoms while you're waiting for surgery. And I do think it's important to work under physician supervision when you're using these devices because they could be potentially dangerous for you. So far we've been talking about spinal surgery and some of the techniques, and it's also important to recognize that there are potential downsides with doing a spinal decompression. It is surgery, and it is surgery on the spinal canal and the contents, and so there are risks. One of the most common risks is a spinal fluid leak. This is particularly common in cases where the stenosis or the compression is very severe, and cleaning that area out is very difficult. In those cases, you can get spinal fluid leaks. They're usually easily managed by your spinal surgeon, and they can be repaired at the time of surgery without causing any ill effects. Another potential complication is what's called spinal instability, and what that means is that there is this abnormal motion between the vertebrae, and ultimately that will require spinal fusion to treat. It's pretty rare, probably less than 1 to 2% of all cases. Another important concept is to understand that if you do a spinal decompression, the spine will still move after the procedure, so it's not a spinal fusion. And if there's motion, there's a potential for further degeneration. So the procedure does not stop the spine from aging. It does not stop future wear and tear. It does not stop future degeneration. And your stenosis over time can recur in that area. So finally, who should consider having a spinal decompression surgery? Spinal decompression is reserved exclusively for patients who have severe compression of the spinal canal and the spinal nerves, and corresponding symptoms as diagnosed by a board-certified, fellowship-trained spinal surgeon such as myself. Surgery should only be considered as the last line of treatment. I really hope you've enjoyed this video. As time allows, I will make some more in the future. I think they're really helpful for patients in understanding concepts in spine surgery. Thank you.